you were to happen to find your dog unconscious, the first thing that we're going to want to do is to see if the dog is breathing and has a heartbeat. So we're going to come up behind your dog and we're going to say, doggy, doggy, or whatever your dog's name is, are you okay? And you're going to take your right hand and put it onto the dog's chest underneath its front leg. And then take your left hand and I'm going to open up the airway. And at this time, I'm looking for any type of rise and fall of the chest, any breath across my hand, any movement at all. And if this dog does not have a heartbeat, or is not breathing, that's when we're going to start our CPR. The first thing I'm going to do is I'm going to open up the dog's airway so I can give him breath. Pull the tongue out past the canines. I'm going to make a nice tight seal. Now with dogs, since they're all different types and all different sizes, the larger and even the medium-sized dogs, we're actually going to give breaths through their nose, because there's really no way we can cover their entire mouth with our mouth. So I'm going to give 2 full breaths in through the nose. Then I'm going to watch the rise and fall of the chest just to make sure that the air is going in and coming out. And then I'm going to give a second breath. And again, watch the rise and fall of the chest. And then I'm going to feel in the artery, the femoral artery on the back leg for any type of heartbeat. And we're going to do this for about 5 to 10 seconds. If we have no breathing, we have no pulse, no heartbeat, then we're going to give chest compressions. And take my right hand and put it underneath the dog's front leg. Take my left hand and make a fist, and I'm going to bring it underneath the dog's chest so the dog doesn't rock back and forth when I give chest compressions. And when I do chest compressions, we're going to do straight down with the heel of our hand so that we get a good compression of the heart in between our hands, our right hand and our left hand. And when I do this, we want to simulate the actual heartbeat, the natural heartbeat, which is approximately about 90 to 100 beats per minute. And we're going to do this pretty quick. And you're actually going to do 15 chest compressions. And the speed that we're going to go is 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15. And I'm going to get my breaths again, pull the tongue out past the canines, make a nice tight seal. Watch the rise and fall of the chest, give another breath. Watch the rise and fall of the chest. Back in position, thumb underneath the front leg. Take my left hand, bring it underneath the chest, and I'm going to give 15 chest compressions. 1 and 2 and 3 and 4 and 5 and 6, 7 and 8, 9, 10, 11 and 12, 13, 14, 15. I'm going to open up the airway, give a full breath. Now I'm going to actually do 4 cycles of that, 15 to 2, 4 times. And that only should take about 1 minute, so it's a pretty good speed that you're going. And then after I do my 4th cycle, ending with my breathing, I'm going to check again for the pulse. And if we have no pulse, no breathing, then of course we're going to continue. A lot of people always ask me in class, how long do I do this? Until you relinquish the dog to a vet or a medical authority. If it were my dog, if I had to do this for an hour, hour and a half, I would, or anybody else's dog. I would never quit. I do offer these classes at my facility. We're located in Ahwatukee up on Ray Road, approximately 1 mile off the I-10 freeway.